Yeah. Hello, hello, hello. I'm Dr. Hockman, the medical matchmaker. I help doctors find the jobs of their dreams. And one of my passions is helping private practices and physicians to remember why we chose medicine and for those practices to be able to be profitable so that we can take medicine back and really just be our own bosses. So I have the coolest guest today. Dr. Gibbs is an otorhinolaryngologist, an ear,
Yep.
nose, and throat doc. And she's created this pretty cool course. So any primary care doc watching that's family medicine, pediatrics, internal medicine, or really anyone that may be interested in providing allergy treatment in your office, this is your gal. Dr. Gibbs, can you tell us a little bit about this course that you've created?
Sure. Okay. Well, first of all, I'm Dr. Dana Gibbs. I've been an otolaryngologist in private practice for almost 23 years at this point. And um, about 2 years in, I figured out pretty quickly that I couldn't fix everybody with surgery. And I tried sending people to the general allergist, and they would come back with the prescription for Allegra, and oh, you're not very allergic, and all the problems that I was seeing them for I could trace right back to allergy. And so I was like, okay, I have to learn how to do this myself because this isn't working. And so I did, and as otolaryngologists, we're pretty lucky, and we have access to a subsection of um, the ENT Academy called the AAOA, Otolaryngeal Allergy section. And they teach basic and advanced courses and basically get you started on doing allergy. And so I did all of that. And then I went to a second allergy society and got more support, more help, and really learned how to support my patients to really get them well, not to just fix their anatomy, but to actually really get them feeling good. And that's where I got started. But then as I got more and more into it, I started going to this other allergy society called the Pan Am Allergy Society. And that was a really interesting group because it didn't just have otolaryngologists in it. It had every kind of doc imaginable, from wellness to primary care to GYN to psychiatry to, there was still a lot of ENT doctors, but it was a lot of different docs. And that was such a cool group. And we did a lot of, old time, out of the box thinking. And as I was in that group for a long, long time, I ended up becoming one of the faculty members and teaching the course that they did for basic, and really starting to agitate for, well, let's modernize this. Let's make it simpler. Let's make it more accessible to the everyday doc, so that we can bring it to more people. And we were in the process of doing that when COVID hit. And COVID really, we were not 21st century. I have to admit that. We were not 21st century. And COVID basically shut the society down. We were not financially solvent anymore when we couldn't give live courses, and it just folded. And that's been kind of weighing on me. Plus this idea that I have this cool idea to modernize allergy to the point where pretty much anybody who's smart enough to be a doc and motivated enough to get through residency can do this in their office. And so I started building a course for allergy, and I've run through it once with kind of I'm going to say a guinea pig client, but it's really, I'm starting to kind of really get feedback and get it perfected, and offering it to more physicians at this point.
Yeah, that's really cool. And for those of you watching, I'll tell you, I've actually taken a sneak peek at this course, and it's really cool. As a family doc, I think this would be such a cool service. And as as practice owners, we have to innovate or else we die. So this is one of those really cool ways that you can provide an amazing service to your patients and increase your revenues so that you can keep your doors open. So that's just awesome. So in the course, so if I were to take the course, what would I be learning?
So the course is really very comprehensive. So we start with the very basics. We start with how you would need to set up your office in order to offer the different levels of allergy services that are out there. We start with some immunology review. We start with what is allergy. We start with what kind of patients have allergy, pharmacology, environmental management, which are also parts of treating allergy. You really have to have all three prongs besides allergy shots or drops. And you have to treat them with medicine, and you have to get them somewhat away from what they're allergic to in order to get them better. So then you would learn how to do allergy tests, how to record allergy tests, how to be safe when you're doing allergy tests. And then when you're ready to move on from that, how to either order an allergy shot set for a patient for administration in your office, or how to mix an allergy shot set, how to administer the shots, how to record the shots, how to get paid for doing the shots, and then on into more advanced topics after that, if you have the stomach for it.
So it's pretty comprehensive. And I'll tell you, in one of the practices I worked in, we did allergy shots, and it was just, we would only take them when they're at their stable dose. And then we would get the shots. And I'll tell you, every time a patient came in for their allergy shot, I reviewed what to do for anaphylaxis. And it's really, I mean, come on, it's simple, it's basically EpiPen and call 911. But every time, like, that is very scary. Like, oh my goodness. So do you address that in the course, or that, all the fears that we would have as primary care docs in
Absolutely. And I will tell you that the part of the otolaryngologist's philosophy in treating allergy is to really minimize that anaphylaxis risk. There are several ways that we do that, and several techniques in order to make absolutely sure we know that we're not giving the patient a dose that's too strong for them, to make sure that we're moving up in a measured stepwise approach so that we can see the anaphylaxis coming in a way to ensure that we're not accidentally giving the patient a wrong dose. I mean, there's a lot of preventive measures that can be used to make sure that we're not going to inadvertently do something that's going to make it higher of a risk that there's anaphylaxis. That's one thing. Of course, there's going to be emergency drills. There's going to be training on how to use an EpiPen. Every patient takes an EpiPen home with them and learns how to use it. And really, emergency protocols are basically provided for you, and training protocols are provided for you in the office so that you don't get in trouble. But that ENT philosophy really changes the frequencies, the severity of these allergic reactions. And I'm not going to say we've never had to give anybody an EpiPen in my office. That is not true. But I can count a number of times on one hand in 20 years. And that's pretty remarkable, considering I was speaking to a general allergist the other day, and she is having an allergic emergency in her office maybe every 6 weeks. And I was just shocked. I mean, she told me that statistic, and I was in shock. I was like, oh my gosh, I can't remember the last time I had to shoot somebody with an EpiPen. So really managing your risk is super important, and it's something I spend a lot of time in detail in the course talking about.
That's really cool. And, just as a family doc myself, listening to it, I'm like, oh, that's a little overwhelming. But you'll be there, and you would hold our hands. And I mean, and some of them are video, and we can watch them again. And
absolutely, most of it's going to be, it's all going to be recorded, so you can watch replays. Yeah,
that's wonderful. And then you'll be there to help us and help make us feel like, oh, little less scared. That's awesome. And then as a practice owner, I think one of the concerns would be just thinking about, some feedback I've had from physicians when it comes to similar things is, maybe we don't have the time or the space, or it'll cost us too much money to do and all of that. So, um, you know, does it cost the practice money to be able to provide that service for their patients?
So yes, I mean, you have to buy some supplies and serum in order to do the testing. But once you buy that initial tranche of serum, you have enough to do maybe 100 allergy tests. And when people are first starting out, they're doing maybe 1 or 2 allergy tests a week in the office. So that maybe $5,000 to $6,000 investment is going to last your office over a year, and it's going to net you, oh gosh, between $200 and $300 per test. When the cost per test, if you break that initial investment down into a per test amount, it's probably less than $20 in materials cost per test to do the testing. If you're going to mix your own shots, I generally don't start people mixing their own shots until they've got 15 to 20 patients on shots. So you're purchasing the allergy serum from a supply company as you need it and marking that up and passing it on to the patient. So there's really not a giant additional cost there until you're ready to mix your own serum.
So it's really a great way for primary care offices to stay open, to be able to maybe support some of the things that we do that make negative money, like vaccines or anything like that.
Vaccines, I didn't realize vaccines made negative money, but that's terrible.
Well, sometimes I don't.
So an analysis that I did kind of a hypothetical, theoretical analysis of my office, and I used some quotes from a manufacturer and tried to figure it out. And what I figured out was that if you're adding 1 allergy patient a week to your practice, and half of those patients decide to go to allergy shots, or even 40% of them decide to go to allergy shots, then your net increase in collections is somewhere on the order of $40,000 a year for 1 patient a week. And that's if you end up with, at the end of that first year, with 16 allergy shot patients. And of course, the second year you do it, then you're going to have 16 more allergy shot patients, and each allergy shot patient takes shots for 4 to 5 years. So it becomes quite a substantial amount. And then there are ways to bump that up even more that are very specific and detail oriented and kind of beyond the scope of talking about today. But you're going to net somewhere around $1,000 extra per year for an allergy shot patient coming in your office. So it's pretty good.
Yeah, that's really nice. And the need for it is pretty low. I mean, it's the equipment, and then you already have a room, you already have medical assistants. So it's pretty cool. Like that's really cool to be able to do. And I'd love to be able to keep my patients with me. And I loved chit-chatting with my patients, which maybe isn't so good for revenue, but it would be nice to see them weekly. So that's great. And then what about, if someone's listening to this and thinks, well, why don't I just send them to my allergist? What are your thoughts there?
Okay. Well, so I'm going back to when I first started, and my impression was, and my impression still is, that an allergist is there to take care of very, very sick and very, very high risk patients. And I would send my chronic sinusitis patients over there, and they would get an allergy test and be told, oh, you're not really that allergic. Here's your Allegra, go away. And my problem was those patients were in my office every other month wanting more medicine, more, I want a steroid shot. I want this, I want that. I'm sick, I'm miserable, but not sick enough for the allergist to do anything about it. And that's middle ground. It's not a trivial thing. I mean, this is not somebody who has allergy for a week in the fall and a week in the spring and takes Allegra and is fine. This is not them. They are miserable 6, 8, 10 months out of the year, and they're bothering you all the time, and you're spending a lot of time with them anyway. Why not put them on allergy shots and make them happy and not have to give them steroid shots, which we all know are not good for you to keep taking steroid shots. So that's kind of, yes, you can send them to the general allergist, and probably if they've had anaphylaxis before, or they've got a stinging insect allergy or something really quite severe like that, that's the kind of patient that I would actually send to the general allergist. But the rest of them, why not help them? Why not? I mean, 90% of allergy care is already given in primary care offices. Why not offer them something that legitimately can cure them?
That's very true. And you bring up a good point that, we have such a shortage of physicians and not just, specialists, but primary care docs as well. But especially when it comes to the allergists, we want those people seeing. I went to the allergist to see my severe allergy patients, whereas just the seasonal allergies, if I can take care of that myself, we can decrease the burden on the allergists and then be able to maybe have shorter wait times to be able to get in to see them for the really severe
really
allergies.
who need it. Yes, exactly.
Yeah, that's a really good point. That's awesome. And tell me a little bit about how you support your physicians when they're going through the journey of learning allergies and providing the allergies from you.
Okay. Sure. So the course is right now it's 7 modules, and we try to do. I asked people, do you want to do one giant 2-day workshop, or do you want to do it in modules? And everybody I've asked so far said, let's do it in more bite-sized chunks. So it's 7 modules right now with Q&A afterwards, and also with interviews with manufacturers reps, because that's kind of one of the things you don't really get if you just take a lightning course is, okay, who do I go to buy all this stuff I'm supposed to have? Who do I go to if I want an allergy computer system? Who do I go? So those are extra. And then the plan is for an ongoing monthly specialty topic / Q&A / troubleshooting get together kind of live session. But then I can also offer consultation if you are just struggling and you need somebody to come to your office and watch your techs do what they do. Then we can set that up, and that's part of what I intend to offer.
That's really neat. You're making me think. So I live in Austin, which has the most horrendous allergies. I just want to open an allergy center, but I have a few too many things on my plate already. But
so here's some stuff that I want to address, and it's not anything that we talked about before, but it's an issue that I've seen coming up over and over again. So I just want to address it. So starting an allergy practice, an allergy service, if you're going to offer that kind of stuff as a physician, you or somebody who knows how to handle anaphylaxis and run a code needs to be in the office, physically there at the time of any allergy service that's given to a patient. And one of the trends that I have seen lately that really disturbs me a lot is these allergy service companies and they're marketing very heavily. They're like drug reps. They just show up and they really push, and they're like, oh, well, we'll let you keep 50% of the revenue and we'll do everything for you. And they give the patients the serum to take home and start doing their allergy shots on day 1. And I'm like, oh my goodness.
And it's terrifying.
And literally why they haven't been on the front page of the New York Times having killed people, I'm not quite sure, except that I'm fairly convinced that the serum that they give out is actually basically just water. It has to be, or they would have injured somebody, because they don't make them have an EpiPen. They do their shots at home from day 1. And that's terrifying to me.
Wow.
And, and there are several other fairly egregious practices that those companies do. On your license, in exchange for half the revenue that they generate on your behalf. And I'm like, look, this isn't that hard. All the doctor has to do is take the history. Really, once the program is set up, all the doctor does is take the history and say, you need allergy shots, here's why. And if the patient says yes, great. If the patient says no, okay, come back next year when you need your next steroid shot and I'll ask you again.
Wow.
So anyway, so it just, some of the practices of those companies are just egregious and shocking to me. And I'm a little bit on a mission to try to stamp them out.
Well, let's do it.
The funny thing is, and this is actually a little bit ironic, is that United Healthcare just last month came out with a restriction that says that they will not pay for allergy shot serum that is administered outside the doctor's office.
Oh, well,
and
that's
I was like,
reassuring.
hallelujah.
Oh
Because, yeah, because nobody should be doing that, really.
yeah. Finally, they're doing something good. The insurance company did something good.
Anyway, so sorry, that was a little aside and I got into a little bit of a rant there, but
well, that's huge. You know, there's so many things that like you're going to see in what you're doing that I'm not going to see. That is horrifying. I noticed I was catching flies there.
well, that's kind of
God.
how I was when I first found out about it. I was like, they do what?
That is very scary.
Yeah.
Wow. Well, thank you for providing evidence-based care and allowing us to do the same thing. So if someone's watching this and they say, goodness, I would like to get in touch with Dr. Gibbs so she can teach me to do allergy shots, where can they find you?
Absolutely. So my website is allергyaccessmd.com. That's all one word. And I am on Facebook at Allergy Access MD. And I also have a Facebook group called Allergy Access for Physicians, where I will come and answer questions if people have questions. Once you get on my mailing list, I have free webinars several times a year, and would love to have you.
Thank you. Thank you for providing such a great service. It's so great when there are people out there teaching us to be better physicians. I mean, we're pretty awesome, but
well,
you know. provide better services and stay open.
I am all about private practice docs opening their own practices and winning and succeeding, because it's so disturbing to me to see the corporate takeover of healthcare. It just every time they buy another practice in my town, I'm just like, oh, again, no.
Yeah.
But so I love to see small offices succeed, and if this can help them succeed, then that's fantastic. And one other thing that I just want to mention is that allergy is actually pretty economical for your patients as well. Yes, it really does cost about $1,000 a year to a patient, but if they are seriously sick, they're spending that much on asthma inhalers, on doctor visits, on urgent care visits, heaven forbid, emergency room visits. So, and not to mention missing work and all the misery that goes along with being sick with allergies all the time.
Yeah, it's a huge quality of life issues for sure.
Mm-hmm.
Someone just commented, I'm interested in promoting open noses as a measure to get more comfortable with CPAP or oral appliance therapy for sleep apnea.
Mm-hmm.
Is this video going to be available for rewatch? Yes. Do you have anything to say, while we've got you captive?
Oh, sure. Okay. So open noses. So well, first of all, docs need to look up patients' noses and make sure that they don't have a god-awful, horrible deviated septum, because that is something that can be fixed with surgery, and really probably should be fixed with surgery if the patient has sleep issues because of it. So, and really no, it's like United Healthcare seems to think that Flonase is going to fix that, but really, truthfully, if their septum is really crooked, they need it fixed. So that's thing number one. Thing number two is that nasal saline irrigation is actually pretty darn good for moisturizing your nose, which helps it relax and open up a little bit. It also reduces dust mites that you have breathed. And then there's all kinds of environmental measures that you can do in your bedroom that reduce the amount of dust mites, which are really just ubiquitous, and especially in people's bedrooms. And so some of my other videos have stuff. I actually have a YouTube channel. I don't have a handle on YouTube yet. It's just my name, Dana Gibbs, MD. But I actually have patient videos about avoiding allergens in the bedroom. And I really am a pretty big proponent of doing that kind of thing, even before you think about going on allergy shots.
That's very cool. Well, thank you so much for coming. And I really hope that anyone watching gets in touch with you, because it's such a great service. And it would be such a great thing to provide to our patients. So thank you for coming. I really appreciate having you here today.
I have enjoyed this so much, Lauren. It was so good to see you again.
You too.
Right.
All right. Thanks for watching, everyone. Bye.
Bye.
We're still live.
I
But not
see
for
that.
long. Oh, and